Hey there, fellow Americans. Breaking news that could change the financial landscape for millions of seniors across the nation. Congress is buzzing with a potential game-changing stimulus package that could put up to $2,000 in your pocket. If you're as eager as I am to uncover the truth behind these headlines, hit that subscribe button and ring the notification bell to stay updated on the latest stimulus developments. The latest congressional discussions have sparked intense debate over a proposed stimulus package specifically targeting senior citizens. Unlike previous stimulus measures, this initiative focuses on addressing the unique financial challenges faced by America's elderly population, particularly those struggling with rising healthcare costs and inflation. The proposal, currently making its way through various congressional committees, suggests a tiered approach to stimulus payments, with eligible seniors potentially receiving between $1,200 and $2,400 based on their income levels and specific circumstances. What makes this stimulus proposal particularly noteworthy is its unprecedented focus on the senior demographic. While previous stimulus packages provided broad-based support to all eligible Americans, this new initiative recognizes the disproportionate impact of economic challenges on older Americans. The proposal aims to provide targeted relief to those aged 65 and above, with additional considerations for those over 75 who often face higher medical expenses and reduced income opportunities. The driving force behind this potential stimulus package is the alarming increase in senior poverty rates and the growing concern over healthcare affordability. Recent data from the Census Bureau indicates that nearly 15% of Americans aged 65 and older are living below or near the poverty line, with medical expenses consuming an ever larger portion of their fixed incomes. The proposed stimulus checks are designed to provide immediate relief while longer-term solutions to these systemic issues are developed. Congressional supporters of the measure argue that the timing is crucial, citing the persistent effects of inflation on fixed incomes and the ongoing challenges faced by seniors in the post-pandemic economy. The proposal includes specific provisions for seniors who rely solely on Social Security benefits, acknowledging that traditional cost of living adjustments have failed to keep pace with real-world price increases, particularly in healthcare and housing sectors. However, it's important to note that this proposal faces several hurdles before becoming reality. Opposition voices in Congress have raised concerns about the fiscal impact of additional stimulus spending and its potential effect on inflation. Budget analysts are currently examining various funding mechanisms, including possible adjustments to corporate tax structures and healthcare pricing reforms, to ensure the program's sustainability without adding significantly to the national deficit. The eligibility criteria for these proposed stimulus checks are notably different from previous pandemic-era payments. The current framework suggests a graduated payment system based on annual income, with full payments going to single seniors earning less than $75,000 annually and married couples earning under $150,000. The payment amount would gradually decrease for those with higher incomes, with a complete phase-out at $95,000 for individuals and $180,000 for couples. One of the most innovative aspects of this proposal is its integration with existing senior benefit programs. The stimulus payments would be designed to complement, rather than replace or interfere with, current Social Security benefits and Medicare coverage. This careful coordination aims to ensure that seniors receive maximum benefit from the stimulus while preserving their existing support systems. The implementation timeline proposed by congressional supporters suggests a potential rollout in phases, with the first wave of payments potentially beginning within 60 days of the legislation's passage. The IRS and Social Security Administration would coordinate efforts to identify eligible recipients and streamline the distribution process, building on lessons learned from previous stimulus payment programs. Healthcare considerations play a significant role in the stimulus proposal's design. Recognizing that medical expenses often represent the largest financial burden for seniors, the legislation includes provisions for higher payment amounts to those with documented chronic health conditions or exceptional medical expenses. This targeted approach aims to provide more substantial support to those facing the greatest financial challenges. The proposal also includes measures to protect seniors from potential fraud and exploitation related to stimulus payments. Enhanced security measures and educational resources would be implemented to ensure that eligible seniors can safely and efficiently access their stimulus funds while avoiding common scams and fraudulent schemes that often target older Americans. Economic experts analyzing the potential impact of these stimulus payments suggest that they could inject approximately $100 billion into the economy, with a significant portion likely to be spent on essential goods and services. This spending could create a multiplier effect, benefiting local economies while providing necessary support to vulnerable seniors. The proposed legislation also includes provisions for expedited processing of payments to seniors living in assisted living facilities or receiving long-term care. These individuals often face additional financial challenges and would receive priority status in the distribution schedule, ensuring quick access to needed funds. State and local governments would play a crucial role in supporting the stimulus program's implementation. The proposal includes funding for outreach programs and assistance centers to help seniors navigate the application process and access their payments. This local-level support would be particularly important for reaching seniors in rural areas or those with limited access to technology. Looking at the broader economic context, this senior-focused stimulus proposal reflects a growing recognition of the unique challenges faced by America's aging population. With healthcare costs continuing to rise and traditional retirement savings proving insufficient for many, targeted financial support has become increasingly necessary for maintaining seniors' quality of life and financial stability. The proposal's timing coincides with ongoing discussions about Social Security reform and Medicare expansion, suggesting a comprehensive approach to addressing senior financial security. While the stimulus payments would provide immediate relief, they're part of a larger conversation about long-term solutions to ensure sustainable support for aging Americans. Public reaction to the proposed stimulus has been mixed, with strong support from senior advocacy groups and concerns from fiscal conservatives. Polling data suggests that a majority of Americans favor targeted support for seniors, particularly those struggling with medical expenses and limited income sources. This public support could play a crucial role in building congressional momentum for the proposal. Healthcare provider organizations have also weighed in on the proposal, generally supporting its potential to improve seniors' access to medical care and medication adherence. The ability to afford prescribed medications and necessary treatments without financial strain could lead to better health outcomes and reduced long-term healthcare costs. The international perspective on this stimulus proposal is noteworthy, as other developed nations watch closely to evaluate similar programs for their aging populations. The United States' approach to supporting seniors through direct payments could serve as a model for other countries facing similar demographic challenges. As we approach potential congressional votes on this stimulus package, various amendments and adjustments are being proposed to fine-tune the legislation. These modifications aim to address concerns about funding mechanisms, distribution efficiency, and long-term economic impact while maintaining the core goal of providing meaningful support to seniors in need. The role of technology in implementing this stimulus program would be significant, with plans for enhanced digital platforms to facilitate applications and payment tracking. However, recognizing that many seniors may have limited technological access or expertise, traditional paper-based processes would remain available, ensuring no eligible recipients are excluded due to digital barriers. Community organizations and senior centers nationwide are already preparing to assist with outreach and education about the potential stimulus program. These grassroots efforts would be crucial in ensuring that all eligible seniors, particularly those in underserved communities, are aware of and able to access their stimulus payments. The economic ripple effects of this stimulus program could extend beyond direct recipients. Local businesses, particularly those in sectors serving senior populations, could see increased activity. Healthcare providers might experience improved payment rates for services, and communities with large senior populations could benefit from increased economic activity. As this proposal continues to evolve through the legislative process, it's crucial for seniors and their families to stay informed about potential changes and requirements. While the final form of the stimulus package may differ from initial proposals, the fundamental goal of providing targeted support to America's senior population remains constant.